Want me to go next? No one?
Sure, doctor, and then Superintendent Perone.
All right. From a testing standpoint, we still do not have the capacity to test everybody every day, and we're not going to get there. How and who gets tested and how often, I think, is going to be dependent on the resources and our ability to test. There are many different types of tests out there. And what, and unfortunately, sometimes there's been people have been using, well, you're going to be screened, and they think that means you're going to be tested. Screening is just asking people whether or not they're having fever, whether or not they're having symptoms. Or sometimes people say, well, you're going to be tested, but that means they're just going to do a fever check. There are certain types of tests that will come back in 15 minutes, and then there are other kinds of tests that won't come back for 5 days. It's going to be different, but if you're testing individuals, before a sporting event, that's I can see that, but I don't necessarily. It really depends on whether or not you have the ability to get those tests and to get those test results. I haven't seen many people that have those types of at least those capabilities to do it for a large number of children and a very short turnaround with all the testing supplies. I mean, testing supplies themselves, we were having issues with swabs. We're having issues with viral transport media. We're having issues with testing strips, as well as capacity for the machines themselves. And so it seems well, I'll never say never, but boy, that does seem like a tall task. That being said, if you're sending kids to school, all right, if you are sending your kids to a classroom, then that is the same thing as you're sending them off to go play at sports, just like we talked about travel or not so. If you do not want your child to be exposed, and you've said for your family the best decision is to stay home and distance learn, then you're also basically making that same decision that you're probably not going to be sending them for that very same reason off to sporting events, just because there's so much more exposure. So I think that's one point there, and then I'll leave Scott for the other.
Scott, do you want to go first, and then Superintendent Perone?
Actually, I think Superintendent Perone was gonna.
Okay.
I agree with everyone saying, and that was with our plan. We're providing choice. You have an all-in option where you're coming back 5 days a week, or we're offering a remote option. Because I agree, as a parent, we know our family situations, we know the health of our kids, we know what we're comfortable with. So we felt that was super important to provide the choice. And I, also agree with Scott. For years, schools have been underfunded, and the cost to make sure our kids and our teachers are safe is astronomical. But it's a necessity, and we need the funding for all schools.
Thank you, Pete. Amy, you talked about school funding. Scott, can you talk a little bit about where we're at in terms of, is there enough PPE? Is there capabilities to social distance? How are you feeling about the district's plans? Because they're varied across the board, 600 plus districts in Ohio, I believe.
Right, and what is creating an additional burden right now is the fact that because of the economic downturn associated with the pandemic, that means that local communities and the state are really being squeezed in terms of their tax revenues. So the state already has imposed budget cuts that have been painful. And generally oppose them across the board. Not all districts are facing them the same ways. We also have funding pressures from things like school voucher programs, where you're diverting money away from public schools and sending them instead to private schools. So we are really counting on the federal government, which is uniquely positioned to be able to provide support. And one of the specific things that we're asking for is money for PPE. We believe that anyone who is required to wear PPE to be safe, they need to have that provided to them by the school district. And there's a cost to that. And that's it's not going to be there forever, but it is something that's going to be there for a while. Another cost is substitute teachers. When you have either when you're trying to navigate some kind of hybrid plan where students are partially in and partially out, or whenever you're responding to a situation where somebody's been exposed or somebody's positive for the virus and has to be quarantined, you have to have adults there to provide supervision for the students that are still in school. And so all of those things are essential. The problem with Ohio's school funding system is that it is largely based on property tax wealth, and it's also dependent on the willingness of a local community to pass levies, in order to make sure that there are resources. So we depend on the state and we depend on the national government to provide resources to help equalize opportunities, so that you don't have those kinds of disparities. And right now it's especially important because we're dealing with emergency needs that we don't typically see.
It's close to 3. I'd like some final words from each of you, if that's okay. I appreciate the time so much. Carla, did you want to say something first?
Oh no, these can be my final words too.
Oh, okay. I appreciate it.
Yeah, no problem. So the only other point I really wanted to make from a teacher and a parent perspective was I really wanted to point out that we were thrown into that online learning at the end of the year, and that I would hope now, in talking to our administration, that the online platforms, and Mr. Perone, you could probably attest to this, are going to be more of a concrete virtual classroom rather than just like, oh, we're going to do Zoom here, we're going to do this here. Hoping that it's more of an agenda where like parents know exactly this is what needs to get done today so they can easily check it. And a couple other points I want to make as like a parent, so many things were being brought up like, this is a free website, try this, and it was too much. Really, if we're going to do the virtual, like really come up with like an agenda, and that's what they have to do each day so the child can check it off. And you and I talked about the paper copies. I know myself, I don't like buying ink. So like I would want my school to provide me with the paper copy if that's what it's going to be. And another thing I noticed with my kids, because I have one going into 5th, one going into 1st, pre-recorded lessons worked better than an online Zoom lesson. That way, if they had Zoom sessions at the same time, and our iPad really is the only thing that works consistently, they were able to watch. If it was, a pre-recorded, we could do it at our own time. Mm-hmm. Or if while I'm at work, if they're at home, I can help them when I get home, rather than them trying to scramble, or my dad or my aunt who watches the baby at home, trying to scramble to get them on Zoom, and they might not be as technology savvy as I am. So having that video recorded lesson, but I feel like some parents might be scared of the virtual option because it was so hodgepodge in the spring, and administrators have definitely had time to better plan. Teachers have had better time to plan. If that becomes an option, I just think it's not going to look the same as it looked in the spring, and maybe not to be scared about that. And then this would be my final point from a teacher perspective. I want the best for my kids. And like I said, I feel like I end up working harder and more online because I wanted to make sure I accommodated all of them, whether it was me going to the pantry and dropping off food at their house for them, or me answering emails at 10 o'clock because they were a healthcare worker and couldn't answer, talk to me during the day. But just be gentle with the educators, because we were on call 24/7, and we have our own families too, and we definitely sympathize and empathize with that situation, and we want what's best for the kids regardless of what it is. As long as we have what's safe in the classroom, we're ready to go in the classroom. But if not, I just really think don't be scared of the virtual learning. I think it's going to be a lot better than when it was in the spring. And again, that was a lot to ramble, sorry.
No, excellent points. And I'm glad you brought that up because it really was, one day they were in and one day they were out, and people had to adapt. And it was, pretty chaotic at times for a lot
Yeah.
of parents out there and
Yeah.
teachers trying to
Yeah.
navigate that. Thank
Yes.
you, Carla.
You're welcome.
Amy.
Okay. So I just wanted to mention that, you know, as you said, Carla, you guys were thrown into the fire, basically, in the spring. And the parents were also, but it was definitely on the laps of the teachers to figure out all of this technology in a moment. And as far as I'm concerned, I have 4 kids in 4 grade levels, and all of our teachers were amazing. They definitely prioritize the kids above all. And if you've ever wanted to be the fly on the wall in the classroom to see how your teachers interact with your students, that was your opportunity. There was many times I was in the kitchen listening to the teachers talk. So I think the combination of having maybe the video lessons, but also the moments where they get to connect so they can hear the teacher say, you know, hi, Sullivan, how are you today? That's a big deal to them when they know that there's an adult that knows them and acknowledges them. As far as parents go, I just want to make sure that we remember to support our teachers. They work their butts off, and they're going to have to work twice as hard now. So we have to make sure we do what we can to support them, but also teachers be patient with the parents who are still trying to work and teach at the same time. Doctor, thank you for all of your advice. There's so much information out there. You don't know what to believe, what's right, what's not right. So to me, I go straight to our pediatrician and our family doctor, and that's who I listen to. That's it. So I appreciate, Jen, that you got this organized. Lots of great info.
Thank you for being part of it, Amy. Let's go with Superintendent Pete Brown. Your final thoughts.
You know, when it happened, you're right. We had one day to plan. So you're in a classroom, and the next day you're throwing close to 2,000 students on a computer and preparing lessons and so on and so forth. And I said, when it happened to our teachers the next week, this is going to be our greatest opportunity, because I believe this now becomes the rebirth of public education and the compassion for public education and what our teachers do in the classroom each and every day. I don't know how many organizations in one day's notice can be sent home and completely run a whole organization. So teachers in our district, teachers across the state were amazing, and they needed congratulated for their efforts. Absolutely, online learning will look differently. We obviously had time to plan. And you know, when you're told you're out for 3 weeks, well, you think you're coming back in 3 weeks. You don't think you're not coming back for months. So our plan will absolutely include a structured, you'll have your schedule, you'll follow your schedule. We'll have a blend of online lessons, online live, as well as recorded. And I think everybody kind of sees those needs for our students. Just to note for anybody listening that the superintendents are concerned also about your children. We're concerned about our staff. Our job is to keep everyone safe and have a collaborative effort to make sure that we're putting the plans best in place for everyone. So thanks for including me, and anytime you ever need anything, do not hesitate to reach out.
I will not hesitate. Thank you, Superintendent Pete Brown. I appreciate it. Ricky.
Well, I just like to say, for the parents, I just want to make sure Carla was absolutely right. It was overwhelming, chaotic, a headache. It was a crazy time in life. It was. For the parents, I just want to say, remember that you have supports. Your teachers are your supports. Your principals, support staff are there for questions, comments, concerns. If you don't tell them you have an issue, they'll never know. They can't help you if they don't know that you have this issue. So parents, when you're feeling overwhelmed, reach out. That is what they're there for. This is going to be an interesting time moving forward. So continue to reach out. Let somebody know when you need something, because honestly, everybody's working and trying to do the best they can. And it's really hard. I know maybe somebody can read minds. I can't. So tell me if you need me. That's what I want to know. You know, I want to say thank you for everybody in this forum, and to be able to just speak about what is really going on and how we feel. It's a relief on my shoulders, because just to hear that other people are going through the same things and having the same concerns of uncertainty and safety and And we never even talked about transportation, guys. So I'm just throwing it out there. There's so much to this. As a parent, you have to be concerned about. Do what's best for you as a parent. Don't worry about the pressure that you may feel from the school system, the district, whoever. If that district is not serving your needs, find one that will. Find a school that works for you. All the options are there. And again, thank you all for having me. And I just heard a baby wake up, so I'm going to hit mute.
Ricky, that couldn't have come at a better time. I appreciate your thoughts and your input. Dr. Esper.
Yeah, I think 2 points. One, with this virus, it ebbs and flows. There are high points as we looking at all these numbers, that we see all these numbers coming up and things are going up here, and then eventually they do come down. What we're trying to do is we're trying to buy time. We're trying to buy our time until we have effective vaccines or we have effective preventive measures, and those will come. But two, I would say, and I don't want to be called Dr. Doom and Gloom here, but I will say that this is the fifth or sixth global outbreak of an infection that we've had in the last 20 years. All right, there was the original SARS in 2003, and then bird flu, if we all remember that, back in the mid 2000s, followed by an actual pandemic influenza back in 2009, 2010. And then we have MERS that came out in 2012. And those are just respiratory viruses. Yeah, you remember Zika, remember the Ebola issues in 2014 and 15. And now we have this coronavirus. Now this coronavirus is the only one that really closed everything down because it had the sweet spot of being so infectious and causing severe disease in a very vulnerable populations that necessitated all this. But that's a trend, guys. And I think what I want to point out, though, is that the lessons that we're learning right now and the investments that we're making in education right now for this type of crisis may very well pay off as this trend continues in the future. Maybe 7 years, maybe never, I hope. But I would guess that there may be other similar situations that can come up in our lifetimes that these types of, this type of understanding and these types of lessons will be useful.
Excellent. Doctor, thank you. Scott.
First off, Jen, thank you so much for being such a great host. And this has been a fascinating conversation. I want to first say that I, as part of an organization that represents educators from across the state, I've never been more proud of the work of Carla and our members from all across Ohio in terms of, being able to step up and adapt and serve the needs of students through some really, really challenging situations. And one thing that's so critical for success is the ability to collaborate and work in partnership with one another. OEA has a strong working relationship with the superintendent's organization and with the school boards and with our elected leaders, and we need to continue to work on that. And what that means is those connections and communication and partnerships between parents and teachers and everybody else in our communities is so critical. We are in this together, and we're going to get through it. We're going to get through it because we have each other's backs and because we really care about our kids and we care about our communities. So everything that Amy and Ricky said from the perspective of parents, I think is so good. And Superintendent Perone, I really appreciate your leadership in your school district and what our other school leaders are doing. I think, as Dr. Esper said, we are dealing with some it's a very unpredictable and unprecedented, I guess not completely unprecedented based on, the fact that we've seen these other outbreaks, but for us in the system, this has been challenging. This is why we really depend on having guidance from the state, really, but also, starting with the CDC at the national level, to make sure that decisions, really difficult decisions, aren't driven by politics. They're not driven by, gut feelings or things like that. That they're driven by evidence. They're driven by science. That they're informed by data. And again, we're still learning as we go. But the more we can have standards that are clear, that are enforceable, that everybody, follows together within the resources that they have, I think that's going to be really critical in getting through this and getting through this successfully.
Thank you, Scott. Thank you all so much. Anything else that anyone would like to add? Great. Well, I appreciate your input. Hi, buddy. Yeah, I see you. I'd like to thank you all. Couldn't have had a better panel. I think that this is going to be so beneficial to the viewers who see this on WFMJ.com, whether it be on YouTube, whether it be on our app, and or whether it be on our podcast or broadcast, rather. So I appreciate it, and I hope we can continue to do discussions like this. I think it eases anxiety, but also gives us really important information and strength to move forward step by step. Thank you again.